Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to share the COVID-19 pandemic update with weekly data accurate through August 26, 2021. I want to welcome all of our new students to campus. I would encourage you to look back at some of the previous videos because each week now I don't cover the whole pandemic. I just talk about a few specific issues. And this week I'm going to ask the question, what changes now that the Pfizer vaccine has been approved by FDA, and how is the pandemic progressing? In terms of what happens now that the vaccine has been approved, many of you will recall that about a month ago, I went over some of the reasons why people are hesitant to get vaccines. And there are 7 reasons that we talked about at the time. I'm not going to go through them now, except to say that now that the vaccine has been approved, one of them is taken off the list, which is a good thing. And hopefully folks are more positively predisposed to getting the vaccine now that it's been approved. So now you're increasingly hearing people say, yeah, but I've heard the vaccines really don't work that well. So I wanted to update something else that I shared a couple of weeks ago, and that is this relationship between deaths in the past week and the state's vaccination rate. So if you think about it, if we look at how many people are vaccinated in a given state and how many deaths are in the last week, we're going to get a sense of how effective the vaccination rate is on a state basis. And so this is updated as of a couple of days ago, and that's all 50 states. And high death rates are over here, low death rates are here, high vaccination rates up here, low vaccination rates here. And you can see a pretty strong relationship. The higher the vaccination rate, the lower the death rate. And that's something positive. There's the state of Tennessee, at the time had a 40.9% vaccination rate, 31 deaths in the past 7 days, 0.46 deaths per 100,000. Now, when I showed this before, some folks liked it. Some folks said it's kind of hard to understand that. So I'm going to present the same data, but a different way. And what I'm going to do is I'm going to divide all 50 states into 6 groups based on their vaccination rate and look and see how many deaths they had in the past week in terms of the death rate. So the lowest group, those with under 40% vaccination rate, had a 0.556 deaths per 100,000. The next group I've had about a 5% greater vaccination rate, slightly lower death rate. Then we get into considerably lower death rates once we get to about 45 to 50%, and then 55 to 60% considerably lower. So what if we combine the 2 lowest groups, the 13 states with the least vaccinations and the 16 states with the greatest number of vaccinations? Combine those 2 numbers. And what we can see is in the least vaccinated states, there's almost 4 times more deaths than in the 16 most vaccinated states. Now, I can't tell you that there's a direct relationship because it could also be that people in the most vaccinated states are more likely to wear masks, more likely to social distance. But these are pretty powerful numbers. So let's see how this would play out in a single state. Let's take the state of Tennessee with a vaccination rate of 40.9. What if Tennessee had the same death rate as those states with the highest vaccination, those 7 states that are over 60%? Assuming Tennessee had that same rate, we would have seen about 22 less deaths last week. Now, I can't say that's what would have happened, but that's what the data suggest, that if we had the same vaccination rate and the same low death rate as the 7 most vaccinated states, we would have expected to see about 22 less deaths last week. That's 3 deaths every day. Our hearts have to go out to the family members, the friends, the loved ones of those people that died. Our hearts have to go out to the healthcare workers who took care of them in their dying moments. But our hearts have to break when we realize that it's possible that some, maybe all of these deaths could have been prevented with a vaccine. Our hearts also have to break, or at least be very concerned, because the pandemic is still on an upswing in the United States. This is cases, this is hospitalizations. And just to explain what you're seeing here, going back to cases, the first cases in the US were in March and April of last year. We had a pretty stable number of cases, daily cases, until this explosion in the wintertime. Then it came down and now has been coming back up. And we see the same pattern for hospitalizations. We see a similar pattern for deaths, not just in the United States where we've had 650,000 deaths, but also in the state of Tennessee, where we're seeing this spike in cases, a spike in hospitalizations, and an increasing number of deaths. 13,200 deaths in our state so far. And in the Ballot Health region, the number of people in the hospital is at 281. It's one of the highest numbers that we've seen, again, since this spike about 6 months ago. So what changes? In a way, nothing changes unless people are willing to get vaccinated. The fact that the vaccine is approved should be reassuring to a lot of people. If you know anyone who's been hesitant to get the vaccine, please help them. Please help them make the plans that they need. Maybe drive them there, maybe stay with them. But we need to get more people vaccinated because the pandemic globally, in our nation, in the state of Tennessee, and in our region is not over. The best thing we can do right now is to get as many people vaccinated as fully and as quickly as possible. If you can help other people do that, please do so. If this video can help other people do it, please share it. It is really important. This is the best time that we have to get this pandemic under control. There's a great deal more information on the College of Public Health website. I'd like, if any of you would like to have someone added to our mailing list, please let us know. As I say, please feel free to share this or any of the other videos. I'd like to thank Dara Young for editing, producing, and posting this video. And as always, I look forward to any questions, comments, concerns that you might have, particularly if you'd like me to calculate the death differential for your state. If you had had the same vaccination rate, same death rate as the most vaccinated states, let me know. I'd be happy to try to calculate that. Please, until then, if you can help people get vaccinated, please do so. If you're not vaccinated yourself, please consider doing it. It is really important and timely. Thank you very much.